Welcome back to Why We Nurse. I'm your host, Serena Tobar, and today we're exploring a topic that deserves more conversation: men in nursing. Men have always been a part of the nursing story, long before modern stereotypes, but today they make up roughly 12% of the nursing workforce, and their presence continues to grow. Joining me is Daren Tanchico, a nurse whose journey challenges assumptions and highlights the impact men bring to our profession. We're talking representation, culture, patient experience, and the future of a more diverse nursing workforce. Daren, welcome to Why We Nurse. Let's start with your story. What inspired you to become a nurse, and what does your journey look like so far?
Perfect. Okay. So I actually, out of school, didn't start as a nurse. So my initial path kind of out of college was as a medical researcher. Whenever I started my kind of career after high school and after college, it started in the research sector of medicine. So I graduated from Houston Baptist, which is now Houston Christian University, with my majors in biology, biochemistry, and molecular biology. It was very research focused based. My first job out of school was actually at the Baylor College of Medicine. I was a research technician in their perinatology laboratory. We actually were focused upon researching kind of the molecular mechanisms behind preeclampsia. It's still ongoing because it's very complex, and there's kind of different uh, perspectives that have to be explored. However, the kind of the medical research environment wasn't my jam. One of my big topics and kind of one of my big responsibilities as a researcher was to kind of go to the hospitals to talk to mothers that were giving birth and ask for their placentas to be donated to our studies so that we could process them and kind of look for biomarkers and different things that could possibly tell us more about preeclampsia and the onset and what happens there. So for me at least, I like talking. I like interpersonal kind of interaction, but the lab environment's very kind of isolating. So to me, it was tough. But it was actually with the interactions with the research nurses that I kind of got sparked in thinking about nursing as a career, because they would come and talk to me like, hey, the way you talk to the patients, you are able to like really connect with them. You are really able to kind of answer a lot of their questions. And like we've heard, you're not like so happy like at the lab. So you should consider becoming a nurse. We think you'd be really great. So I just kind of ran with it. So I got my BSN. And during that time, I kind of also found out that I really liked teaching because, I was able to do well in nursing school. So I got pulled and I guess essentially voluntold or offered really the opportunity to become the peer tutor. So kind of helping my classmates understand difficult concepts, fluid and electrolytes, things like that aren't necessarily the easiest thing to understand. Through that experience, I found that I actually really liked teaching, breaking down complex topics that normally are really scary or really difficult to understand and making it easy for people to get. So I continue with that. And then again, professors during nursing school are like, hey, you're really good at connecting with your peers and kind of explaining things that are really hard to understand. You should think about teaching in the future. And so here I was just trying to become a nurse. And then now they're like, what? I should teach too? I mean, I guess. So that kind of led into like my first kind of career in the medical ICU, where I found that I really did like breaking down complex concepts. It wasn't necessarily patho or pharmacological action anymore. It was like, hey, this is why the doctors and the nutritionists, the dietitians want you to eat foods with less fat and less cholesterol. That's why you had this stroke. That's why you had a heart attack. I like breaking stuff down that way. So, with that in mind, I pursued my MSN, my master's in education, nursing education, and that's been great. I stepped into the role of an adjunct clinical instructor, and that was so much fun. I just loved it. I've taught at and I teach at different nursing schools, and it's really kind of a challenge, like trying to find ways to break down complex things so that my students get that light bulb. But that is such a great feeling whenever I see someone that has been struggling to understand something and they suddenly get it. And that is such a great feeling. So I found my forever home in bedside nursing now. I'm now working in the neonatal ICU, which is adjacent to the L&D, the OB area. So I get to interface and interact with all those kinds of different patients. But the little tiny babies have my heart. That's my forever home. That's where I'm going to be bedside forever. No more big, stinky adults. But I'm going to be with like the little tiny babies. And then, like, kind of through that as well, I was able to pursue my DNP. I was able to get my doctoral nursing practice in educational leadership. My actual implementation project was on my unit on the NICU. My project was utilizing the golden hour protocol to improve thermoregulation in high risk neonates. And I did it on the unit I worked on. So we did interventions to help babies reach a stable temperature more quickly after birth because it's unstable temperature is one of the biggest things that causes an increase in mortality and morbidity in our tiny babies. It was really such a blessing, really so nice to be able to work with a population, a patient population that I care about so much and use it to further my education. So now I'm here. I've reached a terminal degree. There's still some people that are like, you should think about a PhD, but we'll we'll rest first, but just kind of through my journey of nursing so far, I feel like I've seen and done so much, but I feel like it's like I've barely scratched the surface. There's so many different things that we can do as men in nursing. So it's just been a wild ride and I love it. And I can't wait to see what happens next.
We definitely have the research background for PhD.
Right, right.
So you might have a little leg up there.
True, true.
I'm still working on my PhD.
Mhm.
I've got to just dig in and finish it. I'm so close yet so far.
Yeah, I know. It's like just kind of incremental change towards the goal, but as
Yeah.
long as you're going in the right direction.
So let's talk about, did you face any stereotypes or assumptions when you first entered nursing school?
So I did. I think first thing, I'm Filipino. So a lot of people are just kind of like, "Oh, of course you're going to be a nurse." It's like, "Of course you naturally come to nursing." So there was that, but that didn't really affect me so much. It's kind of one of the big stereotypes that kind of came up was when I was approaching my OB class, my maternal class. Because there was kind of this idea that guys, y'all will do okay, all the material's fine, but when you get to OB or maternal, you're going to struggle. You don't have the parts. You don't know what that's like. And, it may be tricky for you to really understand all of that. And patients may just not necessarily want you to take care of them, because you are male. And then besides it being cultural, it's like not a lot of women want a male nurse whenever it's an OB adjacent area. And that really made me think because when I would go through my med surg clinicals or my fundamentals clinicals, a nurse was a nurse, it was a nurse, it was a nurse. Outside of the cultural barriers, which I 100% respect, it made me think, how come I can place a Foley catheter on a female patient on a med surg floor, on an ICU floor with no issues? But then there's kind of like this hesitancy suddenly whenever you're in the labor and delivery, right? Or in the postpartum area. It really made me think. And I still actually come across those barriers now, especially in the NICU. One of the things that we really try to do is to encourage breastfeeding for babies that are able to. And certain parents, certain mothers will see me and they say, "Oh, well, can you call lactation? Well, can you ask that nurse over there to help me instead of you?" Because my sister is amazing. She crochets and she even like made me these crocheted breasts so that I could be hands off and teaching moms on like how to position and how to move. But I haven't been able to use them because currently, as of now, like none of the mothers have wanted me like directly teaching them on breastfeeding. Okay. So it's something I still do kind of come across. And I have just gotten to a point where, it's like, this is one small part of everything that I do for my patients. As long as I'm able to kind of get my patients what they need and what's best for them, I'm happy with that. It's just kind of an interesting observation.
Yes.
Other units, they have like this kind of thought process. It's like, oh, we're doing a head to toe assessment, listening to breath sounds and everything. Now, surely, of course, you can maintain modesty with like the gown or with towels and everything. But then when it comes to other areas that are specifically OB adjacent, there's suddenly like a stereotype or like preconceived notion like, oh, wait, no, 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 no men.
And it is really a barrier, and it's very strange.
Mhm.
So I also teach, and so I've had students who do have a tough time when it comes to that OB rotation. Some of the nurses are like, "Well, you can just stay out here and do homework. You can't really go in the rooms." And so how are they supposed to meet their clinical objectives, number 1? But then I've also had students who were male who really wanted to be an L&D nurse. And when you really think about it, what is the difference between having an L&D nurse that's a male and an OBGYN that's a male? Because
Right,
male OBGYNs are not taboo, but
right, right.
male L&D nurses are. And it's just a very strange kind of culture that I don't know if this is a culture we've created within nursing itself or if it's just a sub American culture where we kind of see like males are supposed to be doctors and females are supposed to be nurses. Like if we're still kind of in that mindset. So that's why it's okay to be a male OBGYN who also does not have the parts and cannot
Right.
really relate. Um,
Sure, yeah.
but it's not okay for a male to be an L&D nurse. So yes, that's definitely an interesting observation and something that's kind of been milling in my mind for a little while.
Hmm. Yes, for sure, definitely.
So, who are your early role models or did you have to become one for yourself?
So I would say my mom is definitely one of my biggest role models, especially in nursing. She was very like typical Filipina that was thrust into nursing. Kind of sometimes there weren't choices, so she kind of went with it. But she grew in the profession and she actually really enjoyed it. She's been between an L&D nurse for over 30 years, and then she had transitioned now into like a PACU, OB-GYN PACU nursing, and she does enjoy it. She's still nursing even though she's kind of sunsetting in her career, working once a week. But I have learned so much from her about how to be a great nurse. One of the things that really stuck with me when I started nursing school was actually something she told me. She said, regardless of how you feel and who the patient is, just imagine that it's me in the bed. And you don't have to worry about not doing everything you can for your patient. You don't have to worry about missing anything for your patient. Because I'll know that if you think you're taking care of me, you're going to do the best. So
Oh.
that's something I really carried with me. And actually, she's so amazing to me in nursing in general because she actually was pursuing her MSN as well. When I was younger, my sister was younger, but then amidst all the schoolwork, all the projects that she had to do, there was me asking her for help on my math homework. And then there was my little sister tugging at her, asking to play tea party. So she actually gave up her MSN so she could focus on us,
Oh.
and then she kind of told us later on, it's like, I gave up my advancement in nursing to higher degrees in hopes that I could have helped you guys pursue higher degrees in nursing on my behalf or higher degrees in general on my behalf. And we did. I was able to get my doctoral degree, and she was so happy, so excited about that. My sister was a registered dietitian, and she was able to pursue her master's. So my mom always tells people, I gave up my master's, but I was able to generate two instead.
Oh. That's so
Yes,
sweet.
I still come to her with questions about certain things because She has been an L&D nurse for years and years and years, and obviously moms in the L&D are going to have certain things that will affect their babies in the NICU. So I will just go to my mom and ask, like, hey, so this mom did this thing during her pregnancy. Is that common? What's going to happen to the baby? And she's like, oh, okay, brew some tea and let's sit down. I'll tell you about this. So I still interface with her all the time just to kind of like talk about things that I worry about or things that I'm just not knowledgeable about since I am a NICU nurse and I'm not a primary L&D nurse, but she will give me that side of the story. And it kind of enlightens me like, oh, okay. So that's why they paged us the delivery early and we had to stand there for 30 minutes. Yeah. So yeah, she was a big role model for me, definitely.
Oh, wow, that's
Mm.
wonderful. So, men have played a meaningful role in nursing throughout history, from military caregivers to early monastic healers. But the modern narrative often overlooks that. From your perspective, how do men contribute uniquely and powerfully to nursing today?
I kind of see how men affect the field of nursing. And it's actually really interesting because one of the schools that I teach at right now, I'm doing this study on student engagement. And so I've split the class into groups where they compete very similar to like the Harry Potter houses. So they all split into groups and they will compete through different modalities. And their symbol is going to be one of the key people in nursing. So there's a group that's under Clara Barton. There's one under Sister Calissa Roy. There's one under Ida Jean Orlando. But it was really interesting because as we were kind of looking at these figureheads in nursing, what really struck me was that Walt Whitman was one of the ones that was like considered like one of the contributors of nursing, especially during I forget which war. There was a war, but he served as like a medic. So like medic adjacent like for nursing. Okay. So a lot of people don't realize they think and look back and they see Florence Nightingale, they see Clara Barton, they think it's very female led, right? But then you look at that and I saw Walt Whitman. I was like, whoa, not only were you a fantastic author, you were essentially one of the pioneers for guys in nursing. So that was really interesting to see. Now, regarding and practice and everything, I think something interesting that we bring to nursing is just kind of besides being the Hoyer lift to help people with turning and like repositioning our patients, I think we kind of bring different flavor to nursing. So I'll use me as an example. So on the NICU, on the day shift, I'm the only male nurse. So whenever I take care of babies, it's very interesting because not only have my coworkers and my mentors kind of told me about this shift, but whenever I take care of a baby, the baby always reacts differently. I think even just hearing my voice sometimes, I'll be like, hey, baby, good morning. They just kind of look up and that's not, it's like that voice sounds different. There's a different way that I nurse these babies, right? So not sure about the biological implications of male versus female, but like even whenever I'm doing playtime with the older babies that have been there for a few months, they respond really well to me during therapeutic play. Whenever we're doing tummy time or we're doing stretches, tossing the baby up, they react really well to that. And then I don't know if it's a timbre of my voice or like the way that I'm interacting with them. Whereas I've noticed other coworkers of mine that interact with the babies, it's mostly all of their female. The babies tend to cry a little bit more or want to be cuddled more. Well, with me, they just want to play. They just want to interact. And then moving away from just me among my students as well, um, I feel like guys in general bring a totally different flavor in nursing. From my students that have become nurses and touching base with them, they feel like they can build rapport with patients a little bit easier sometimes. Some of my male students, especially trending towards more trauma-based units, more what you would consider more stressful units like the surgical ICU or the ER. They feel that they can sometimes utilize their physicality or the fact that they are a male, especially if they're in mental health nursing or crisis nursing, to kind of utilize that as a advantage to not only de-escalating situations, but also to assist their coworkers as well. Because I mean, for lack of a better example, it's like if you have someone that's in a acute psychiatric emergency, it would be perceived as safer to call the guy that looks like a 6'8" linebacker to help de-escalate the situation as opposed to a 4'8" nurse that maybe isn't as strong or isn't as comfortable dealing with a full-grown adult. Not to say that everyone is constrained to those stereotypes, but we are able to fill in certain gaps that people may not necessarily perceive as the usual nursing role, if that makes sense.
Yeah, yeah, it definitely
It-
does, and you alluded to it or mentioned it earlier about being the lift, and I think
Yeah,
that's kind of the ongoing joke is when you have the guy on the unit, the male
right.
nurse, we're always like, "Can you come help us lift?" But they have so much more to offer than just being the lift or just being the de-escalation tool. They can provide so much knowledge and so much support in so many different ways. And flipping to the different side of it, do you think that men in nursing experience a different kind of burnout or emotional expectations?
I think we do. So a lot of times I feel like as men, we're expected to kind of be able to manage feelings a little bit more easily and more quickly as compared to other types of nurses. I guess an example would be like dealing with patient death. So the medical ICU that I worked in during COVID was got converted to a COVID ICU. Every single patient that we took care of for those years were COVID patients and they were severely ill, critically ill. I think during that time, it was very hard because a lot of our patients, you received them from the ER and you just had this inkling or that nursing gut feeling that they essentially are now here in the hospital and they're going to die here. Because especially early on during the COVID-19 pandemic, we hadn't really found a differential and effective treatment at the time. And the vaccinations weren't out yet. So things were escalating very quickly, very fast for a lot of patients. I think that there was a bias that if you had a male nurse there and he had a patient die, you could turn that room over really quick. Oh, it's okay. He got it. He's going to call life gift. He's going to bag him and you can get him the next patient really quickly. So during that time, I think it's not just me, but other men, other even women on the unit, we had to really compartmentalize because there were just so many people that had to be seen so quickly. And then we didn't have appropriate time to grieve really our patients. Sometimes you would receive a patient coming in and they would very shortly code, their heart would stop or their breathing would stop, and you would try everything you can, but then they would expire or die. And then it almost felt like an assembly line at a certain point because it's like, okay, well, this person is dead. So we need to clear the room because someone else who's still alive and close to dying needs to make it over so that we can have a chance of saving them. So I think they just kind of saw us as let's focus on them first because they should be able to manage their feelings more quickly, as opposed to other nurses where it's, oh, give her some time. It's a lot. She had a patient die, so there was uh that stereotype that wasn't necessarily healthy. And then even bridging it over to the NICU, sometimes we have babies that we take care of for months. And then regardless of everything that we do, sometimes those babies can still die. And as a nurse, sometimes like I feel like, oh, he's gonna be okay. He's fine. He'll be able to manage it. But then it's like, no, like I've grown to know this baby. Like sometimes you feel like you're like an adjunct parent, essentially, another parent or another family member, right? So it's like I've cried for NICU babies that have died, that I've gotten to know. It's just sometimes, like when people see, it's like, well, you'll be okay, but it's not necessarily the case, right?
Yeah, it's that societal bias on men that's kind of filtering into nursing as well because men in general are supposed to be strong and they're supposed to walk it
Right.
off and
Yeah.
they're not supposed to show emotion, they're not supposed to
Mhm.
cry, they that's weakness. And so I can definitely see how that can filter into nursing. So with these biases in mind, what do you think we can do to address gender bias in nursing education and leadership?
Okay. Especially in the field of education and nursing education, I feel like there's this immediate bias in men that, it's like, oh, they're going into nursing to become a CRNA. Oh, they're coming into nursing, they're going to become the CEO or the CNO. I think that there's this kind of bias that, when you see a man in nursing school, um, they're not going to be a bedside nurse. It's like, oh, they're going to be leadership. They're going to be a CRNA, which, there may be a higher percentage of that. I don't know what the percentages are or the numbers of enrollment, but I think that kind of limits other students on what they can pursue. I will always remember a group of my students saying, it's like, oh, well, your boyfriend's in nursing school too, so he's going to be like a CRNA. So that means once he hits that, you can just be a PRN princess. You don't have to be a nurse anymore. And it's kind of like, well, I mean, she came back and was, well, actually, he was planning on supporting me through CRNA school, and then he could be at home with the kids. And people are like, "But why?" It's like, he's the guy, he'll go to CRNA school, right? And then hearing that, it made me really think there are these gender roles that are kinda ingrained in certain aspects of society, especially in American society, right? Where, uh, you know, men are usually gonna go out and work hard and be the breadwinners and whatever, and then mom may stay at home, right? But again, like in that situation, I wanted to clap because I was like, oh yeah, it's gonna be her going to become a CRNA, and dad's gonna be a PRN prince. He's gonna be at home with the kids. So I think that sometimes, even in textbooks or PowerPoints that I've received to teach with, I think that sometimes there's a bias because they will show the physician or the healthcare provider is usually a male in a white coat. And then all the nurses are female with maybe one nurse male in the back that's just tall. So maybe that's why he's one in the back. But I feel like just kind of how everyone is portrayed, sometimes even in our media that we use to teach, it shows that bias towards men in being higher positions sometimes. So I actually like to mix it up a lot. Whenever I do prepare lectures or PowerPoints or some things, I will 9 times out of 10 try to make the healthcare provider a female, and then just from my perspective, I'll usually try to put a male nurse in. And then they're like, "Oh, well, you have to tell the doctor. You have to tell him." I was like, "Well, actually, the doctor is her." So I try to kind of flip the script on him a lot of the time, right? Or in simulations where you have a standardized simulation experience, especially in pediatrics. You have a kid that's in the hospital, parents are at work. 9 times out of 10, students, "Oh, we gotta call the mom. We gotta call the mom." I'll be like, "Oh, well, actually, mom's not in the picture, so you're gonna actually have to call dad." And they're just like, "What? Why? What?" It kind of like takes them aback because they'll realize, like, "Oh, yeah, you call the parents." It's like it's not always just call mom for peds, right? Because there are situations where there may not be a mom. or it's dad that's going to be the primary caretaker. So just little thoughts like that, I try to dig in and help students remember we're a veritable mix of different practices, people. We're very diverse. So I think in nursing education, we have to be mindful that the doctor's not always going to be male. The nurse is not always going to be female. In certain situations, you're not just always de facto calling mom. So
Yep.
just kind of inching towards like a more equitable representation, I think would be fantastic. That's somewhere we can definitely improve.
Yes, I totally agree. And I think since I've been in education, I've been more mindful about, like you said, when I'm doing PowerPoints or when I'm creating presentations and I'm pulling stock pictures to use, I'm more mindful about who is represented in this stock picture. Do they all just look like me or do they look like the group as a whole? And so that's kind of one of the things that's really made me, because I never thought about it before. I'm just like, okay, first stock picture that pulled up, that's the one I grab. And then when you go back and think about it and you look at it, I'm like, oh, all of those people in that picture look like me. And I have a group that looks very different that I'm teaching. So they cannot relate to this picture, and that may make them tune out right there, and then they don't hear any of the important information that I'm trying to tell them
Right.
because they're already tuned out because they feel like I can't relate to them.
Definitely. And it's even in our lecture. Whenever we go over questions or whenever we go over, it's like, oh, you want to notify the healthcare provider. I try to be very mindful and say, oh, what are you going to do in this case? They're like, oh, you need to call the doctor. You need to tell him that blah, blah, blah. And so I will do my best to even throw in. So in this situation, things are changing fast. So you have to call the doctor, make sure to let her know that, or I'll even try to throw in gender neutral terming. So you have to let them know that blah, 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 just to get them to think and realize, oh, yeah, we should call her. Yes.
Exactly.
Yeah.
So looking ahead, what do you think the future holds for men in nursing?
So I think, honestly, as time goes on, there's just going to be more and more opportunities that arise for men to really step in. I think as a whole, overall, it may just be it's me being very hopeful, being very optimistic. I think that there will be less resistance to men in certain areas. Because even with a recent clinical group that I had, there was a male on the L&D. So my students were like, oh my gosh, Sarah, is he the PCA? Is he the tech, the surgical tech? He must be the surgical tech. And then he was, okay, I'm going to take a student today. And then they were, well, we're here for nursing L&D clinical. And they're like, yeah, I'm an L&D nurse. And then my one male student was, what? You? And he's like, yeah, you want to learn or up to you. And he was so good with the patients. All my students that rotated with that nurse had the best time. He was a fantastic educator and he built rapport with his patients so quickly that he was able to gain their trust and was able to do whatever they needed immediately. Regardless if it was a male or female student that was with him, they had the best experience. And I think honestly, as time goes on, I think that's going to be less of an issue that pops up in people's minds. I think that regardless of where you are, over time it'll be like, oh yeah, they're the nurse. Oh, he's the nurse. She's the nurse. As generations continue on, obviously, there's still kind of like that bias when a male walks in. Oh, it's the doctor. But I think with time, people will start to be like, oh, who are you? Oh, I'm the nurse today. And it's okay. So less of a preconceived notion and more openness because there are male nurses in the female perceived specialties of nursing. They are out there. I'm in the NICU. We have our fantastic nurse that was in the L&D. I think it's just going to continue to permeate because it seems long ago, but when nursing first started, like a few hundred years ago, it was female. It was just
Mhm.
a female profession. Men did not go into nursing. And now we are here in nursing, contributing in whatever way we can. And I think that just as time goes on, it's just going to be an afterthought at that
I
point.
I love it. I asked a nurse one time. This one happened to be female, but I think it can translate to a lot of men why men go into nursing. And so she said, I was in medical school, and she said I got pretty far, and then I realized that the doctors don't really do anything for the patients. They're not the ones doing the care. They're organizing everything, they're evaluating everything, and they provide an invaluable service to the patient. But they're not the ones holding the patient's hand. They're not the ones getting the patient that comfort. They're not the ones that help the patient with their activities of daily living. And that's what
Right.
she wanted to do. And I think that that can translate to a lot of men and why men have come into nursing, because they want to be that comforter. They want to be that caregiver. They want to
Mhm.
be the one doing the things.
Right.
So, how can organizations better recruit and support men in nursing?
Okay. So I think oh, they just need to go out and actively recruit. One of the organizations I'm a part of is the American Assembly of Men in Nursing. They essentially have an all male membership, which helps support other men in the profession of nursing. They'll do meetings, they'll do presentations that talk about certain gender biases in certain fields of nursing. They have discussion boards as well where they show the support. There's a venting thread. Oh, what happened and how did you deal with it? Because having it available and out there helps other men that maybe are coming across certain barriers or certain challenges as well see, oh, I'm not alone. This does happen. And hey, this is what one guy did. Let me try that. Or, oh, hey, that one guy works in this unit and I didn't think that we could work on that unit. Let me try. It's like you see yourself on TV, essentially. You see the representation. So it's encouraging, very helpful. And then also just with same what I alluded to with education materials, all organizations like across the board, you can have like the AWON, the American Women's Health, and I think I forget what the rest of the letters stand for, but whenever it shows the memberships, it tends to be all female. There are men in those specialty areas also. So again, put your audience on TV so they see themselves reflected to help encourage and support as well.
Well, great. So, Darren, thank you so much for sharing your story, your
Thank
insights, and
you.
your voice. Your journey reminds us that nursing grows stronger when more stories and more identities have space in it. Men have always been a part of the nursing profession, and their impact it continues to expand in powerful ways. To our listeners, whether you're a nurse, a student, or considering joining this profession, know that there is room for you here. Follow at Why We Nurse on Instagram and Facebook for updates and behind the scenes content. Got a story to share or want to be a guest? Email me at whywenursepodcast@gmail.com. Until next time, stay strong, stay compassionate, and remember why you nurse.